Hello, everyone. So my part of this tag team effort was to talk about the environment itself, because at the end of the day, everyone has to be somewhere. And I think that's important to bear in mind when we're thinking of designing a system for people who will use our long-term care services, that if we don't design a system that allows them to be in a long-term care home, if that's what they need, they will be somewhere, and that somewhere may not be all that good. So this is where my somewhere is. I work at the Veterans Care Program at Parkwood Hospital in London, Ontario. I work in the Veterans Care Program, which is a long-term care service for almost 300 Canadian war veterans. And the objectives of my talk today are to consider the influence of the physical environment on human behavior in the context of long-term care homes. I'm going to do two things. I'm going to talk about the evidence base for incorporating specific design features and also talk about some of the conundrums. So for those of you who are thinking, and what is a conundrum? A conundrum is also known as a problem, a puzzle, a riddle, a poser, an enigma, or a brain teaser. For example, why are the most discontented people the most easily satisfied? Any guesses? They're satisfied with nothing. Okay, recent reviews of the evidence base for incorporating specific design features into long-term care homes. I'm also fortunate that Richard Fleming and colleagues did a review paper on this topic for the IPA task force and the special edition that David was talking about, and basically looked at the world literature on this topic. And here are their results, their conclusion of their review. They would say that designers can confidently use, in other words, there is good solid evidence in support of unobtrusive safety features, camouflage your doors and so on, varying the ambience, size, and shape of spaces so that you don't just have the long hospital corridors that look all the same, providing single rooms, maximizing visual access, so not lots of corners and concealed areas, and controlling levels of stimulation. They would say that there's actually less agreement. So in other words, not that there isn't research, but that people have come to different conclusions in their research on the usefulness of signage, again for this population who may not be able to relate to the signage, on homelikeness, on provision for engagement in ordinary activities, on small size, and on the provision of outdoor space. Another group from the States that has done a considerable amount of research in the area of design in long-term care settings reached relatively similar conclusions in their 2006 review. They concluded that the evidence showed that the residents' quality of life was linked to better outcomes, those being things like improved sleep, better orientation and wayfinding, reduced aggression and disruptive behavior, increased social interaction, and increased overall satisfaction and well-being associated with how the unit was laid out, again, getting away from the hospital look, supportive features and finishes, in other words, making an environment that is helpful to people for mobility and so on, reducing the noise, and they thought access to outdoor spaces was substantive enough to put on the plus side. They thought there was growing support for providing support in the environment for functional abilities and for opportunities for the residents to be physically active and healthy, but not really, again, definitive studies. They thought that their review showed that safety in long-term care environments was increased by removing the barriers to ambulation and the performance of critical tasks, so in other words, making the environment more amenable to the functional abilities of the people who are using it, on preventing infections, and preventing unsafe behavior such as exiting. Staff stress was decreased by providing support for their work and home-like ambience. So Fleming's review suggested that the evidence is a bit mixed on the value of a home-like ambience, and the American review suggested that, well, staff like it. Okay? So I thought I'd focus on that issue because it's gotten a lot of press. On your table, you have the handout that directs you to some very useful articles from the AKE around some of the technical things like lighting and doorways and signage and so on that you can look up. But this home-like business, that's been a buzzword for quite some time, and the evidence is a bit mixed about it. So I thought we'd focus on that for the rest of today's talk, because really we're talking about people who are going to live out the rest of their lives in their home being a long-term care facility. So should it be, what do we mean by that? So when is a door not a door? When it's ajar. When is home-like home? Unfortunately, I don't have a snappy answer for that one. Homelikeness, however, is sort of I think a reasonable definition that parrots what you'll find in a variety of different documents. The premise is that being in an environment that is more like the homes they left behind when they transitioned to long-term care would be more comforting for long-term care residents than the one that is reminiscent of an institution. It's kind of the principle. Okay. So let's take a look at what kind of homes people may have come from. Well, first of all, it's interesting to know that the government has an opinion on what is an adequate home. It's from the Canadian Mortgage and Housing Corporation. Suitable housing has enough bedrooms for the size and makeup of resident households according to the National Occupancy Standard requirements. Did you know we have National Occupancy Standard requirements? Yes. Enough bedrooms based on NOS requirements means one bedroom for each cohabiting adult couple, unattached household member 18 years of age and over, same-sex pair of children under age 18, an additional boy or girl in the family unless there are two opposite-sex children under 5 years of age, in which case they are expected to share a bedroom. A household of one individual can occupy a bachelor unit. Okay. So that's basically the Canadian standard for a home-like. Who meets this standard? Well, interestingly, most of us do. In 2006, 7 out of 10 Canadian households, about the same percentage as 2001, lived in acceptable housing. That is housing that met adequacy standards, suitability for repair, suitability standards around crowding, that's what you just heard about, and affordability standards. Homeowners were much more likely than renters, however, to meet this standard. And interestingly, this is where you start to get into the choice issues. 60% of the households that were not in acceptable housing, so this isn't the community, this is the homes that people come from, 60% of the houses that were not acceptable according to those standards, the people who lived in them had enough money that they could have lived in what we consider to be acceptable standards if they'd wanted to. So the choice becomes an important issue. And of those not living in acceptable housing, homeowners were much more than renters to have things the way they're supposed to be. Interestingly, those with disabilities are far more likely to be in housing that does not meet the standards. And those who come from the more vulnerable segments of the population, for example, rooming house residents, are much more likely to, those who live below the poverty line are much more likely to not have meet those standards. And it's interesting, as we move towards aging at home and the concept that communities and families will be able to ante up and provide support for people in their homes, it's these more vulnerable segments of the population that don't have the family and community support that are likely going to be more in need of care and more likely to be in our long-term care institutions. And what was home-like if home-like is supposed to be like what it was before? Okay. And not to let them be forgotten, there is actually a fairly large, and this gets into gender issues, but a fairly large population that are aging in an institution already, who are also going to eventually be somewhat disenfranchised and more vulnerable and more likely to end up in our long-term care institutions.